When we think about the crises of homelessness, addiction, and mental illness, we often think of the way these things can manifest in strange or dramatic behaviors. Behaviors that the rest of us may have a difficult time understanding. Dr. Maureen Murphy-Ryan is a resident in psychiatry at the University of Washington in Seattle. She's worked closely with clients who suffer from addiction and from severe mental illness, often without stable housing. Of particular interest to her are the acute symptoms of mental illness that often show up where these three things meet: psychotic symptoms. Most of us have observed someone suffering from psychotic symptoms. We may share a common image of what it looks like, though it's perhaps stereotypical. Dr. Murphy-Ryan conjured up, as an example, the idea of a disheveled-looking man walking down the street, talking to himself and gesturing to the air, seeming to be in a world of his own.
It's interesting. That's only a very small part of what psychosis is and what it means. So when we see somebody and they are, if somebody is hearing voices, hearing things that, the rest of us are not detecting, we would call that an auditory hallucination. And that's an example of one type of symptom of psychosis.
Mental health experts divide these symptoms into two types: positive and negative. A hallucination is considered a positive symptom, not because it's pleasant, but because it adds something to a person's experience, beyond what the rest of us would consider to be the evidence of our senses. Hallucinations can be auditory, visual, sometimes even physical sensations. Perhaps the most profound symptoms of psychosis come in the form of delusions, when the mind makes connections or creates narratives about the world that are not based in reality. But to someone suffering from them, they are just as real as anything else. Then there are the negative symptoms. Those are most noticeable in things like disorganization and isolation, things that subtract from someone's ability to function in daily life.
They can lose interest in things that they used to be very interested in. People may isolate. They may lose their ability to really detect subtle changes in other people's facial expressions. So they lose this kind of social richness of their life. And so the motivation for it and the ability to really pick up on things socially can really disappear.
While positive symptoms are perhaps the most noticeable, Murphy-Ryan explained that negative symptoms can have the larger impact on someone's ability to thrive, even survive. There are at least one way that someone can end up losing their housing or lack the wherewithal to navigate a way back into housing once unhoused. Substance use can be a major risk factor for psychotic symptoms, both through intoxication and withdrawal. The big culprits, according to Murphy-Ryan, are stimulants like methamphetamine or Adderall, cannabis, and alcohol. Almost anyone can develop psychotic symptoms for a list of reasons, but because of these cause and effect relationships, addiction, homelessness, and psychotic symptoms often appear together, and they compound one another.
Having housing decreases the risk that you're going to have those psychotic symptoms. I mean, our reaction to substances is really influenced by our state, our environment. So having housing, even if you engage in the same behaviors, might decrease the adverse effects of substances, for example.
There's an ongoing debate about whether the way to address the issue is with a housing first or treatment first model. Dr. Murphy-Ryan thinks it's a false choice. For the best chance of helping people, she says, housing and treatment need to be provided together at the same time.